So that came out of the pandemic again. So, if the pandemic did anything, it really forced innovation quickly, and to try new things. So one of the new things that we learned in the pandemic was how to utilize the volunteers to help to individualize and personalize care. So in Advocate Health, we have over 10,000 of volunteers. Over 500,000 hours every year are graciously given to the volunteers, and that time occurs to support patients either at the bedside, in greeting, etc. So it's all patient-based. So we're using the volunteers to improve patient experience, quality, and safety across the organization. And what grew out of, again, the pandemic was that virtual connection. So we have over 100 virtual of volunteers, mostly pre-med. So we have, again, over 100 virtual volunteers. The majority of them are pre-med. So they learn how to navigate in Epic. They learn how to talk to patients, so they call patients upon admission. So within 24 hours of being admitted into the hospital. And because of that focus that I had mentioned before, that over the age of 65, they call patients over the age of 65 admitted from the emergency room in a hospital bed. And with that, they welcome them. And then they ask, is there any additional family member support that they would want to contact? And if they do, and then the volunteer can reach out to them, make sure everyone knows, and then connect them back into the patient. Also, if the patient needs anything, the volunteer can coordinate that. So in the past, if you were to stop and think about it, that conversation occurs with nurses. So if a patient, let's say, came to the emergency room via ambulance, maybe trouble breathing, and then they had to be admitted into the hospital, they could have left their hearing aids, their glasses at home on the bed, on the bedstand. So in the past, that would have been communicated to a nurse, and the nurse would have had to call the family and then try to coordinate pickup. Now, the virtual volunteer, basically the pre-med student, then takes that off the nurse's plate, and then they reach out to the family and help to coordinate pickup and delivery of anything that the patient may need at home. We're also seeing sometimes patients verbalize they may not know how to order food, let's say. That's a chance then we can help to coordinate that. They may not have an iPhone charger. We can help coordinate that. So it's another touch point. So the volunteers are another touch point then that we can use to personalize and individualize that experience for a patient. And because of the pre-med piece, we're also helping to teach the doctors of the future how to talk to patients, how to talk to family members, how to use Epic. That was something that we learned from the students, that one of their takeaways. So a lot of them have gone on, accepted into med school. We're finding out that one of the excellent things about this program is that they learn how to navigate in Epic through the process. Okay, that was that was an unintended ripple of the program, but we have I think our first pre-med into resident, and then is graduating next year. Got accepted to a fellowship, so we're excited for him. But I think it's just a great example, though, is how to engage the community, engage key stakeholders, help them align and support patient care, and through that process, we see these ripples, these positive ripples in the community that really impact patient lives.